One of the things that we did in the council sections, the administrative board, was to present this idea of micro-credentialing. And so we were the ones that first kind of spearheaded it because we did need to have some kind of certification on micro-credentialing in which if I were trying to put someone in a position of assessment that they could come and say, I've been trained or I have this certificate. And so developing micro-credentials was an important way of them being able to be that they're certified, but they actually had some backdrop and context to why they're the best person for that position.
The great thing about micro-credentialing is that you're being recognized on a national level by the American Dental Education Association, that the work that you're doing has been peer-reviewed and that is of quality work. And I think all of the institutions out there that have promotions, that's something that they're evaluating in determining if they're going to give you promotion in their institutions.
There are often times when someone wants to advance themselves. There are also times when you need someone to do specific things, but they may not have all of the experience or all of the knowledge. And so the idea was that if we could get people who we are grooming to go into leadership roles, to have these trainings and be able to foster an environment which they could learn things that they needed to advance their careers.
And that's really the big intent of the Micro-Credential program that have been developed in partnership with members from the Micro-Credential Program Oversight Work Group and members of the Council of Sections community to really create a rigorous plan to ensure that members are fulfilling those missions.
And then the digital badge that they receive, people then that come in contact with these digital badges can actually see the work that they've done in order to obtain it.
So say you're interested in looking for a faculty development opportunity that's accessible to you and affordable. Its design is really to be accessible to everyone.
ADEA micro-credentialing program is excellent for under-researched schools. For schools that don't have the ability to develop their own program, this micro-credentialing process is really great. It's a place where you can send your faculty, they can be certified, they can get new skill sets that help the classroom teaching or the clinical teaching.
The Micro-Credential Program Oversight Work Group really put some thought into what are 5 different, diverse, and distinct topics we could pilot as we started thinking about the Micro-Credential program.
And the 5 that we chose was directly related to teaching. They would apply to anybody in any specialty, in any allied health area, and so we thought that those would be a good area to start with.
And micro-credentials have the ability to bridge the gap between academic learning and true practice.
And so what this does is it gives you the ability to learn and gain some skill sets around specific things that you didn't learn in your oral health professional training. And so it's a way of really bridging things that you need to know to be a better instructor that you don't get on the pathway of becoming a better dentist.
The best way to get involved with the micro-credentialing program is to actually get a micro-credential, receive a micro-credential, and then tell others what it meant to you to go through that process.
There's so much to be excited about this program, especially about its potential to really make meaningful impact for oral health and allied health education. When we think about where it can go, I think the opportunities are endless.